first.
No objection, Your Honor.
All right, thank you, Mr. Gorgian. And Ms. Brazil, if you'd be kind enough to provide 44 and 45 to firefighter Seneff and me.
Thank you, Your Honor.
May. Do you want to publish it?
Yes, I do, Your Honor.
There being no objection, thank you. Ladies and gentlemen, each one of you is going to get your own copy of People's 45, as before. Please put your your seat number circled on it, as well on this one as People's 45. People's 45. Counsel, do you stipulate that Mrs. McNeil need not transcribe, Ms. Brazil?
Yes, Your Honor.
Mr. Gorgian?
Yes, Your Honor.
Thank you. It's accepted. This is People's 45, ladies and gentlemen. People's 45 with your seat number, please. We have a few missing copies, or are they just floating around? Who doesn't have? Okay, 3 alternates, please.
I apologize, sir.
That's all right. Two, 3, and 5. Again, this is People's 45. Does everyone have a copy? Yes, thank you. As before, ladies and gentlemen, People's 44 CD is the evidence. People's 45 is a guide only. If you hear something differently, rely upon your own determination. Ms. Brazil.
Thank you, Your Honor. May I proceed?
You may.
We do have a pulse with CPR, and we know if I can give you a total of medications on board, if you'd like to, but yes, go ahead. We have a total of 4 EPIs on board. That's in the station, is it? Okay, that's it. We have a total of 2 EPIs on board, 2 atropines on board, and 1 bicarb on board. And that's where we're at. And total time down, the asystole? You're going to have to tell me what time it is right now. Sure, it's 12:57. Okay, our initial time of dispatch was 12:21. So if you want to round it off at 12:20 to 12:18, 12:20, somewhere around there is when the event occurred. Okay. All right. If there's nothing further, we're going to call it here. And time of death is 12:57 from our end here. Okay, let me run it by the doctor real quick here. Okay. Right now, UCLA is in the belief that any further efforts would be futile. We could stop everything right here, or if you want to assume care, we can transport to UCLA. The doctor here wants to definitely transport. Okay, make sure he's in the rig with you on the way here, and we'll see you in about 10 minutes. All right, and I'm going to high profile UPI, VIP, and we'll be right up in there 7 days out. All right, 71, you 7 days out.
That concludes the playing of People's 44.
Thank you, Your Honor.
Thank you.
Mr. Seneff, once you receive that information from UCLA that they believe that the efforts that you have undertaken have been unsuccessful and that death has occurred, Dr. Murray is going to assume control and care of the patient, correct?
Correct.
Now, when you are in the room the entire time, you told us that you saw an IV pole, correct?
Correct.
With a saline bag attached to it.
Correct.
And Mr. Jackson had an IV port in his leg that was compromised, correct?
Correct.
And was there an oxygen tank in the room as well?
Yes.
Did you see any other medical other than those items that I have listed?
I did not.
During the time that you are caring for Mr. Jackson, did Conrad Murray request any medical treatment for you and your team to perform?
Yes, he did.
What did he request?
He asked for us to do a central line.
And what is a central line?
That is a line that goes directly into an artery in the chest.
Is that a procedure that paramedics perform?
No, it is not.
Why is that?
We have no training. We don't have the equipment with us, that sort of thing.
Is it accurate to say that a central line procedure is one that is performed by a physician in a hospital setting?
That's correct.
Did Conrad Murray offer to perform that procedure himself in order to attempt to save Mr. Jackson?
Frankly, I don't recall whether he was offering to do it or whether he was asking us to do it.
Well, you indicated that you, paramedics, did not have proper equipment to perform a central line procedure, correct?
That's correct.
Did Dr. Murray say, here, I have the equipment, I or you can perform a central line on Mr. Jackson?
No, he did not.
He offered no equipment whatsoever to perform that task that he requested, correct?
That is correct.
Did Dr. Murray request you to perform any other procedures or provide any other medications to Mr. Jackson?
Yes, he did.
What?
He asked us to administer magnesium.
And did you have magnesium to administer to Mr. Jackson?
No, ma'am.
Did Dr. Murray provide you with any magnesium that he had that he or you could provide to Mr. Jackson in an effort to save?
No, he did not.
You have described for us the significance of the information contained on People's Number 43. I'd ask you to take a look at another document. Your Honor, I have a 2-page document. I'd ask that it be marked People's Number 45. Oh, excuse me.
6.
Thank you. People's Number 46.
It is.
Mr. Seneff, I placed People's Number 46 on the projection screen. Are you able to see it clearly from your vantage point, or would you like me to bring a copy up to you?
I caught her.
Okay.
Or if you could zoom it in, maybe?
I'm going to.
Okay.
Well, maybe that'll be better since it's dark.
A lot to comprehend because of the writing.
Yes, Your Honor, I don't intend to go through every line of the document with the witness. Mr. Seneff, I know you can't see the entire document, but would you describe what this document is, please?
It's our medical report that we do on all patient contacts.
Did you fill out the information contained on this report?
Yes, I did.
Is it formally known as a 902M run sheet?
That's correct. It is a 902M.
Does this doc contain comprehensive information related to the care provided pursuant to the 911 call in response to 100 North Carrollwood on June 25th?
Yes, it does.
Did you complete this document? Are you the author of it?
I am the author.
And when did you complete the information contained on this document?
After the call was complete.
Your Honor, may I have the lights, please?
Thank you. Yes.
May I approach?
Certainly.
I'd like to go over just some of the information with you generally on this document. Is the information concerning the times of the administration of the starter drugs contained in this document, starting 9 through 1250?
Yes.
And the information concerning the responses of the blood pressure, pulse, respiration, and so forth, the readings that you provided to us, they're also contained here in this document, correct?
Correct.
Did you also record the information concerning the medication information provided to you by Dr. Murray on the Form 902, as well as your own notes contained on Exhibit number 43?
Yes.
After UCLA base at 1257 indicated that they were prepared to call time of death, what efforts continued within the bedroom area?
Well, at that point, we knew we were going to be transporting, so some time would elapse, so we gave some sodium bicarb.
Sodium bicarb to Mr. Jackson?
That's correct.
As a result of giving Mr. Jackson sodium bicarb, was there any change in his condition?
No, there was not.
Were there any other efforts or medications provided to him prior to transport?
No. No.
When Mr. Jackson is transported, is he taken from the upstairs bedroom downstairs on a gurney or a backboard?
On a backboard type device.
Who takes Mr. Jackson down from the bedroom, down the stairs on the backboard?
All of us that were there.
Describe who you mean by all of us.
I mean our fire captain, our firefighter, and paramedics Goodwin, Blunt, and myself, and Engineer Brigandy.
Presumably, some of the fellows are carrying the backboard, maybe two on each side.
That's correct.
Are there also resuscitative efforts being conducted as Mr. Jackson is being carried down the stairs from his bedroom?
That's correct.
Describe those efforts, please.
Well, when we're carrying him on the stairs, right up into the stairs, you can still do CPR, but it's not possible to really do CPR on the stairs. So that stopped. We're carrying him down the stairs, but at the same time, he's still being ventilated with the bag valve mask device through the...
Once you get down to the foyer area of the residence, is Mr. Jackson then transferred from the backboard to a gurney with wheels?
That's correct.
Once Mr. Jackson is transferred to the gurney, what do you do next?
I turn around and go back up to the room to get our equipment.
When you return to the bedroom, do you see Dr. Murray?
Yes, I do.
Describe for me what you see Dr. Murray doing when you return to the bedroom.
He has a bag in hand, and he's picking up items from the floor.
Where is he located when you see him with the bag in his hand picking up items from the floor?
Near the nightstand.
On the far side of the bed?
On the far side of the bed.
Your Honor, may I have the lights, please?
Thank you.
Thank you. Mr. Seneff, I'd like to direct your attention to an exhibit previously marked as People's Number 23. Does this photograph permit you to show the area where you saw Conrad Murray located when you returned to the bedroom and he was picking up things off the floor and putting them in a bag?
Yes, it does.
Would you use the pointer, please, and so indicate?
He was standing in this area right here.
May the record reflect the witnesses indicating the area which would be on the far side of the bed between the side of the bed and the white chair.
Yes.
Mr. Seneff, I notice in this photograph there appears to be there is a blue object or area. Do you see that?
I do.
What is that?
That is a blue ambu bag.
Is that one of the ambu bags that you used or your team used to try to resuscitate Mr. Jackson?
No, ma'am.
When you were retrieving the items that you all had used, I'd like to ask you to look at People's Number 21. Does this photograph allow you to show us where you were located when you were in the bedroom and you made the observations of Dr. Murray near the bed, by the nightstands, picking up items?
It does.
Would you use your laser pointer to so indicate, please?
I was standing approximately right here.
May the record reflect the witnesses indicating the foot of the bed on the carpet closest to the far side of the bed near the red chair. Is that accurate, Mr. Seneff?
That's accurate.
Thank you. After you retrieved your items, what did you do?
Lights back on?
Yes, thank you, Your Honor.
Went back down the stairs to the ambulance.
When you turned and left the bedroom, was Dr. Murray still in the bedroom?
Yes, he was.
Did you then go down the stairs, exit the residence to the ambulance area?
Yes, I did.
At some point after you were at the ambulance area, did Dr. Murray join you in the ambulance? Join you in the area near the ambulance?
Yes, he did.
At this point, is Mr. Jackson loaded into the ambulance, ready to go?
Yes, he is.
Did you and your team then transport Mr. Jackson to UCLA Medical Center?
Yes, we did.
When you left the residence, where were you located inside the rescue ambulance?
I was seated in the jump seat, which is at the head of the gurney.
So you are closest to Mr. Jackson's head?
That's correct.
Who besides you was in the back of the ambulance?
Paramedics Goodwin and Blunt.
Anyone else?
Dr. Murray.
You are able to make observations of Mr. Jackson's physical condition being right by his head, correct?
That's correct.
Were his eyes still fixed and dilated?
Yes, they were.
Was his skin still tinged blue, meaning cyanotic?
Yes, he was.
Was he still hooked up to a heart monitor?
Yes, he was.
Were there any signs of heart activity displayed to you during the transport of Mr. Jackson's body to the hospital?
No, there were not.
Was Mr. Jackson given additional drugs, starter drugs, to attempt to revive him in the ambulance?
Yes, he was.
What medications was given to him?
Epinephrine and atropine.
Did those drugs produce any change in Mr. Jackson's condition?
No, they did not.
Did you observe Dr. Murray undertaking any activities in the back of the ambulance unrelated to Mr. Jackson's care?
Yes, I did.
What did you observe?
He answered his cell phone.
Did he answer it or make a call? Or do you know?
I don't know.
But you saw him on the phone.
I saw him talking on his cell phone.
Was there any change in Mr. Jackson's condition from the time that you arrived at his location at 100 North Carrollwood at 12:26 p.m. until the time that you and your team transported Mr. Jackson from his residence to UCLA Medical Center?
No, there was no change.
Did you ever see any sign of life in Mr. Jackson during the entire time that you were attempting to save him?
No, I did not.
When you arrived at UCLA emergency room, was that at 1:13 p.m.?
Yes, it was.
total, you were with Mr. Jackson for approximately 42 minutes. Is that accurate?
Yes?
Any sign of life at all during any of those 42 minutes?
No, ma'am.
Thank you, Mr. Seneff. I have no, excuse me. One moment, please, Your Honor.
Sure.
Thank you, Your Honor. Mr. Seneff, I have a couple of additional questions for you. You told us that there was no medical equipment in the bedroom area where Mr. Jackson and Dr. Conrad Murray were located. Specifically, did you see an EKG or an ECG machine?
No, I did not.
Did you see any type of heart monitor?
No, I did not.
Did you see any type of capnography machine?
No, I did not.
You told us that Dr. Murray advised you that Mr. Jackson was a healthy male, he had no underlying health condition, and that Dr. Murray had administered lorazepam to him, correct?
That's correct.
And he was treating him for exhaustion and dehydration, correct?
That's correct.
Did Dr. Murray ever mention to you having administered propofol to Michael Jackson?
No, he did not.
Did Conrad Murray ever mention the word propofol to you during the time that you were at the location or in his presence?
No, he did not.
At no time he mentioned propofol, correct?
No, ma'am.
Double negative.
He didn't. He never mentioned the word propofol.
Thank you.
And when you left the bedroom after retrieving your items, was Conrad Murray alone in the bedroom?
Yes.
Thank you. I have nothing further.
Ms. Brazil, thank you. Cross-examination, Mr. Gorgia?
Thank you, Your Honor.
Thank you.
Good morning. Good morning, sir.
Could you panel cross from the
Absolutely, Your Honor.
podium, please? Thank you.
Mr. Seneff, just to clarify, when you first got the call to respond to Carrollwood, what time was that at?
When I first got the call at the station, it's 12:22.
12:22. And what was the dispatch time?
12:22.
And are you aware, as you sit here today, that the 911 call was placed at 12:20?
I know that's 12:21.
The 12:21 that you're referring to on the teletype, isn't that when the Beverly Hills transferred the call to Los Angeles, the call center?
I do not know.
Okay, so you would agree that the Beverly Hills Police Department record would probably be more accurate, is that correct?
Objection, lack of foundation.
Sustain.
But as you sit here today, are you aware that the 911 call was placed at 12:20?
I'm not aware of
Lack
that.
of foundation.
Overruled. You may answer it.
Okay. I don't know exactly what happens when you pick up your phone and who it goes to and when you're in Beverly Hills.
Okay, are you aware that when the 911 call was placed at 12:20,
Objection mistakes the testimony.
That does. It assumes that's not in evidence. Sustain. You may re-ask.
okay, are you aware when somebody in Beverly Hills calls 911, it gets sent to the Beverly Hills Police Department?
No, I'm not aware of that.
Okay, are you aware that after the call is placed to the Beverly Hills Department, the call then gets transferred to Los Angeles Call Center?
Yes.
Okay, and then from there, the call is then transferred to Fire Station 71, correct?
Yes.
Okay, and that call came in at approximately what time?
12:21 or 12:22 at our station.
Okay. Now, when you first got the call to respond to Carrollwood, at that time, you didn't know this call involved Mr. Jackson, correct?
Correct.
The ad was that this was a 50-year-old adult male in cardiac arrest.
That's correct.
Okay, and when you first got to the Carrollwood residence and observed this person, you described him as being very pale, correct?
Correct.
Underweight?
Yes.
Okay. And I believe you previously testified he was so thin that you were able to see his ribs. Is that correct?
That's correct.
Okay. Did this person look real sick to you?
He looked like he had a chronic health problem.
Okay. And is it fair to say that he had the physical characteristics of someone who had been a drug addict for a long time?
That's a hard statement. There's people who have chronic illnesses can look like a lot of things. I've seen drug addicts that were overweight. I've seen drug addicts that were underweight. So I just recognized what I thought appeared to be a chronic illness.
Okay. And when you first arrived to Carrollwood, were the gates, the front gates of the property already open?
Yes, they were in the process of opening. Drove up.
Okay, so you drove up onto the property at that point?
That's correct.
Okay, and who were you greeted by first?
Security.
Okay, and then the security then allow you into the residence?
That's correct.
Okay, and then security then escorted you upstairs to where Mr. Jackson was, correct?
That's correct.
Okay, and do you recall whether the door to the bedroom where Mr. Jackson was that open?
Yes, it was.
Okay, and what was the first thing that you saw?
Dr. Murray standing beside the bed and leaning over the patient. The security guard also leaning over the patient, and the patient himself in bed.
Okay.
Well,
Okay, and I believe you testified that when you first walked in that Mr. Jackson was still on the bed, correct?
he was actually being moved, so his upper torso was still on the bed, his feet were on the floor, and they were in the process of moving him.
Okay. Can I have one moment, Your Honor?
Sure.
Mr. Seneff, showing you what's previously been marked as People's Exhibit 23. Can you show us where exactly Mr. Jackson was?
Yes, his head would have been right here. His body was at an angle, so this margin of the mattress would have been across the middle of his back, and the feet were being lowered to the floor here.
Okay, so his upper body was still on the bed, correct?
Correct.
Okay. And what time did you arrive at the Curlwood residence?
12:26, I believe.
Okay, and what time did you arrive upstairs by Mr. Jackson?
Less than a minute.
Okay, so approximately 12:27?
Yes.
Okay, so at 12:27, when you first entered the bedroom, Mr. Jackson was still, part of his body was still on the bed, correct?
Correct.
Okay, and did you notice any type of IV tubing on Mr. Jackson at that time?
Yes, I did.
Okay, and can you tell us what you saw?
There was IV tubing connected to his left calf.
Okay, and that would have been, again, at approximately 12:27, correct?
Correct.
Okay, so the IV tubing was still in his leg, correct?
Correct.
Okay. Did you see anything else attached to Mr. Jackson at that time?
I did not.
Okay. So soon after, you start asking Dr. Murray some questions, correct?
Correct.
And Dr. Murray, in fact, starts responding to your questions and gives you some information, correct?
Correct.
Okay. Now, Dr. Murray told you that he was Mr. Jackson's personal doctor, correct?
Correct.
Dr. Murray also told you that Mr. Jackson was rehearsing all night, correct?
I didn't hear what he said, the first part. I heard him say 16 hours last night.
Okay. And Dr. Murray also told you that he was treating Michael Jackson for exhaustion, correct?
For exhaustion and dehydration,
Okay.
yes.
So he also told you he was treating Mr. Jackson for exhaustion, correct?
Yes.
Okay. And you asked Dr. Murray whether Mr. Jackson was on any recreational drugs, correct?
I don't remember if I asked that or not. I have. That's a common question I ask. I don't think I did ask that.
Okay. Do you think it's fair that maybe somebody in your team may have asked that?
It's
Sustained. There's partial answers, Frederick.
Okay. You don't recall asking that question, correct?
correct.
Okay. But Dr. Murray did tell you that he gave Mr. Jackson a sedative to help him sleep, correct?
Correct.
And in fact, he identified that sedative as lorazepam, correct?
Correct.
Okay. And in fact, on the teletype that was shown to you earlier, you in fact had handwritten the word lorazepam, correct?
Correct.
Okay. And are you familiar with lorazepam?
It's not a drug that I'm trained to use. I am familiar with it, but not in detail.
Okay, but it is a drug in your system for an extended period of time, correct?
I actually don't know what its half-life is.
Okay. And can you describe the scene for us when you're asking Dr. Murray these questions?
I was the first one up the stairs, so I was probably I probably had a 5-second head start on everybody else. The doctor and the security guard were moving the patient to the floor, and I'm setting down my box and asking a lot of questions. And firefighter Heron is right behind me, and we moved the patient to the foot of the bed.
Okay, so there was a lot of confusion during this time, correct?
There was a lot going on.
Okay, and it's fair to say that Dr. Murray was busy and he was multitasking at that time?
Yes.
Okay, and in fact, at the preliminary hearing, when you were asked, what you thought of Conrad Murray not responding to a particular question or not responding right away, you said it's because you thought he was busy, correct?
I don't actually remember what I said specifically, but he was very busy.
Okay. So at some point, you then moved Mr. Jackson to the foot of the bed, correct?
That's correct.
And that's to give you and your team more room to work?
That's correct.
Okay, and to do that, you actually needed the help of another firefighter, correct?
That's correct.
And that was firefighter Heron?
Heron, yes.
Okay. And I believe you described firefighter Heron as a big, strong fireman, correct?
Strong as an ox.
Okay. So it took both of you to move Mr. Jackson to the foot of the bed, correct?
That's correct.
Okay. Soon after, you start performing CPR, correct?
Correct.
All right. And who was in charge of the compressions?
Firefighter Heron was doing compressions.
Okay. And who was in charge of providing air to Mr. Jackson?
Firefighter Blunt.
Okay. So there was 2 paramedics performing CPR on Mr. Jackson, correct?
No, that's not correct.
So paramedics were responsible in administering CPR to Mr. Jackson.
Firefighter EMT Heron was doing the CPR. We also had Fire Captain Mills was on scene. I don't think he was doing CPR. Firefighter Blunt was ventilating and getting his intubation set up. Paramedic Goodwin was setting up the EKG cables, and as I said, I was gathering information.
Okay, so Mr. Blount was in charge of the ventilation,
Yes.
okay, and Mr. Heron was in charge of compressions, correct?
Yes.
Okay, so there's essentially 2 people at that point in time working on Mr. Jackson as far as ventilation and compressions go.
Correct.
Okay, and that's not unusual, is it?
No.
Okay, so if you were to hear facts that Dr. Murray asked for assistance during CPR, that wouldn't be unusual, correct?
No. It would
In
not.
fact, that would be encouraged, isn't that correct?
Yes, you wouldn't want to do it alone.
Okay, and you're familiar with the American Heart Association guidelines on CPR, correct?
Correct.
Okay, and the guidelines also provide that people should work collaboratively when they're performing CPR, correct?
Correct.
Okay.
Let me know, Mr. Gorgian, when it's a convenient time to take the noon break, please.
Now it's fine, Your Honor.
May I see counsel first, please?